In tonight's Female Focus, we focus on healing from the heart. The doctor at Grant Medical Center has an extra dose of compassion for her patients because she suffers from the same ailment they do, one that attacks far more women than men.
Perfect.
Eileen Wheaton comes to Grant Medical Center every 5 weeks for an IV drug. It keeps her rheumatoid arthritis in check. After 4 decades of decline, the illness is coming back, according to a study from the Mayo Clinic. 70% of all patients are women. Most are in their 50s or 60s when they're diagnosed.
And you play the mind game with yourself, and you think, oh, you know, I'm getting a little older, is this, that? And the inflammation was just kind of taking over in my body.
The reason that more women are affected is really unknown at this point.
Dr. Heather Lake has a personal interest in treating patients with RA. That's because she has the disease herself. It began in college.
And I remember waking up in the morning and my hands were completely closed. It was, very difficult to get them open. And
within days, the pain moved to her elbows and feet. She saw a doctor who recommended a specialist. She was scared.
Seeing patients in the chairs with various deformities and not really knowing, how the progression of my disease was going to go and what was going to happen.
Dr. Lake says having the illness helps her understand her patient's pain. With RA, the body's immune system attacks and destroys the joints. New drugs help, but don't get at the root cause of the illness. Without regular treatment, damage is permanent. So the doc says that it's crucial to get diagnosed and treated quickly. Eileen is a believer.
I go back to the factory settings, and it has helped tremendously. It really has.
That's good to hear, isn't it? Now, Dr. Lake says with early and regular treatment, patients can live full and productive lives.
It's great to hear. Do you know whether humidity